Hello, and welcome to this session. In this session, aligned with Learning Outcome LO2, understand the requirements and principles of data security, we will explore what it takes to protect sensitive information within health and social care settings. Safeguarding personal data is essential for maintaining trust, meeting legal obligations, and ensuring safe professional practice. This session will outline the key requirements, principles, and best practices involved in keeping personal health information secure. Data security in health and social care is crucial due to the sensitive nature of the information. This includes personal health records and treatment plans. Ensuring this data security involves adhering to strict requirements. These measures protect against breaches and unauthorized access. They safeguard patient trust and data integrity. Compliance with data protection laws is mandatory. Regulations like GDPR and HIPAA set stringent standards. These laws ensure organizations meet legal requirements. Non-compliance can lead to severe penalties. Adhering to these laws maintains patient trust and avoids legal issues. Data encryption is vital for protecting sensitive information. It converts data into a coded format. This prevents unauthorized access during transmission or storage. Implementing robust encryption standards is crucial. Regularly updating these protocols enhances security. Access control mechanisms ensure only authorized personnel access data. Role-based access control restricts access based on roles. Multi-factor authentication verifies user identities. Regular reviews of access permissions are essential. These measures protect patient privacy and data integrity. Regular data backups are crucial for data recovery. They ensure data availability and integrity. Establishing a regular backup schedule is essential. Testing recovery procedures ensures they work effectively. Secure off-site storage of backups is necessary. Secure disposal of data prevents unauthorized access. It involves permanently destroying obsolete data. Using secure methods like shredding is essential. Documenting the disposal process ensures compliance. This protects against data recovery by malicious actors. Confidentiality ensures information is accessible only to authorized individuals. It protects patient privacy and sensitive health information. Implementing strong access control measures is vital. Encryption protects data during transmission and storage. Staff education on confidentiality is crucial. Data integrity maintains the accuracy and completeness of data. It ensures health data is reliable and accurate. Using checksums and hash functions verifies integrity. Version control and audit trails track data changes. Regular data validation checks are essential. Data availability ensures authorized users can access information when needed. It is critical for continuous patient care. Implementing redundant systems enhances availability. Regular data backups and testing recovery procedures are essential. Robust network uptime is maintained through monitoring. Accountability ensures actions affecting data security are traceable. It deters malicious activities by holding individuals accountable. Implementing detailed logging systems is crucial. Regular audits of access logs promote responsible data handling. Policies must address security breaches effectively. Non-repudiation ensures actions and transactions cannot be denied. It provides proof of data handling for legal purposes. Using digital signatures verifies data origin. Audit trails document data access and modifications. Secure storage of system logs is essential. Protecting privacy is a moral and ethical imperative. Health providers have a duty of care. Trust is foundational to the patient-provider relationship. Respecting privacy supports autonomy and dignity. Ensuring data security prevents identity theft and discrimination. Data privacy protects individuals' rights to privacy. It involves consent for data collection and use. Transparency in data handling practices is crucial. Individuals have the right to access their health information. Ensuring data privacy maintains confidentiality and integrity. Organizational policies ensure data security and privacy. They outline procedures for safeguarding information. Data protection policies define data handling practices. Incident response plans address data breaches. Regular audits ensure policies address evolving threats. Regular training sessions are vital for data protection. They ensure staff understand data security principles. Specialized training for IT staff enhances security protocols. Training raises awareness of emerging threats. It ensures staff can respond to potential risks. Physical security measures protect data storage locations. Secure facilities prevent unauthorized access. Surveillance systems monitor access to facilities. These measures protect against physical theft or damage. They are essential for comprehensive data security. Strong password policies are crucial for security. Multi-factor authentication adds an extra layer. Role-based access control limits data access. Regular audits ensure access rights are appropriate. These measures minimize the risk of data breaches. Regular updates and patches protect against vulnerabilities. Secure development practices ensure software security. Code reviews and vulnerability testing are essential. Up-to-date software protects against emerging threats. These practices are crucial for data protection. Firewalls protect networks from unauthorized access. Intrusion detection systems detect security incidents. These measures provide essential protection. They create a barrier against cyber attacks. Network security is vital for safeguarding data. Overall, the evidence shows that data security within health and social care relies on the effective protection of sensitive personal information. Ensuring compliance with relevant legislation, applying strong technical and organizational security measures, and maintaining clear lines of accountability are central to this process. When these elements work together, they not only protect data from unauthorized access or misuse, but also reinforce public confidence in the services responsible for handling their information. For any queries, send us a WhatsApp message at 07484361688, and a team member will be happy to help. Thank you, and we look forward to the next session.